The 7 reasons why your baby may have hiccups. As a parent, you're always concerned about your child's health, and you always have dozens of questions on your mind, such as what causes hiccups in babies. What can you do to get rid of them? Is it normal for babies to have hiccups? If you want to know the answers to all of these questions, stay tuned because today in this video, we will give you the answers to these questions. Let's get started. What causes the hiccups in babies? In babies, the diaphragm is not developed but is in the developing stage. When babies breathe, they first draw air into their lungs, after which their diaphragm contracts and moves downward. The diaphragm then relaxes, allowing the air to exit through the mouth or nose. When they hiccup, their diaphragm spasms and the air entering their lungs becomes stuck against their closed vocal cords, producing the distinct hic sound of a hiccup. Hiccups, according to experts, are caused by the nerve that connects the brain to the diaphragm and can be triggered by a variety of factors, including eating too much or too quickly or ingesting at the wrong time. Let us discuss the factors that trigger the hiccups. Overfeeding. According to Dr. Learman, if babies overfeed or gulp air while eating, it causes gas in their stomach to expand and rub against the diaphragm, resulting in hiccups. Eating too much at once can cause hiccups. So while feeding your baby, take a break, hold them upright to digest the food, and then feed them the remainder of their bottle. Gastroesophageal reflux disease. Hiccuping and burping can be a sign of gastroesophageal reflux in babies, which is a very common and generally treatable syndrome. A baby's digestive system is underdeveloped, causing them to regurgitate stomach acid. This can result in hiccups, belching, burping, and overall discomfort. When babies have gastroesophageal reflux disease, the partially digested food and acidic juices from the stomach flow back up into the esophagus, causing burning and discomfort. Because the esophagus passes through the diaphragm becomes irritated, resulting in many baby hiccups. The symptoms of gastroesophageal reflux disease hiccups include coughing, spitting up, irritation, crying, and back arching, especially during or after a feeding. If you suspect your baby has gastroesophageal reflux, you need to consult your doctor about diagnosis and treatment options. Eating too quickly. Eating too quickly can even cause adults to hiccup, and the same can happen to babies. This can occur if you use a fast flow nipple on your newborn's bottle, or if you have a forceful letdown while breastfeeding. Starting solids can cause hiccups in babies if they are fed too much at once or they are given meals that are too large for their digestive system to manage. Stomach temperature. Abrupt changes in stomach temperature can also cause baby hiccups. Assume you give your baby cold milk and then feed them warm rice cereal after some time. According to Virginie, this combination is capable of causing baby hiccups. Taking in air. Hiccups can also be caused by swallowing too much air. This can occur during feeding. For instance, if your baby is sucking on a bottle nipple without any milk in it, or if your latch isn't deep or secure enough. A baby who keeps slipping off the breast while feeding is a sign of a poor latch at the breast. So to avoid hiccups in your babies, ensure that the bottle is filled with milk and that the baby is taking milk inside instead of air. A quick reminder before we further continue our discussion on this topic. If you've enjoyed the video so far, consider subscribing as we frequently upload informative and educational videos. Let's continue. Burping is required. According to Daniel Howes, hiccups are an infant's way of removing excess air from their stomach or primarily burping themselves. So you don't need to get worried because sometimes a hiccup in babies happens to remove excess air in their bellies, and it's completely normal. Healthy brain development. Hiccuping is one of the first behaviors that babies learn. Hiccups are necessary for the brain and breathing development of a child. The University College London published a study in 2019 that found newborn hiccups play a role in healthy brain development. Because hiccups teach babies how to monitor their breathing muscles, breathing can eventually be voluntarily controlled by moving the diaphragm up and down. How to prevent hiccups in babies? By being mindful of how you feed your baby. Overfeeding your baby, feeding your baby too quickly, or allowing your baby to swallow excess air can all lead to increased hiccuping. Being mindful of how you feed your baby can be beneficial. If bottle feeding, take breaks after your baby has consumed a few ounces. Burp your baby and keep them upright for a minute or two. Don't overfeed your baby. If they appear full, feed them again later. If your baby seems to be swallowing air, try different bottle nipples and make sure he isn't sucking on an empty bottle nipple. If you are breastfeeding, burp your baby between the breasts. You should take action if your baby appears to be choking on your milk. After feedings, keep your baby upright. Trying to hold your baby upright after feeding, whether breastfeeding or bottle feeding, can help them digest their milk and reduce hiccuping, burping, and other digestive discomfort. You should also consider keeping your baby upright during feeding, which can help the milk flow downward. Make use of a pacifier. Infant hiccups do not always begin with a feeding. Allowing your baby to suck on a pacifier when they begin to hiccup on their own will relax muscles in the diaphragm and may hopefully reduce the bout of hiccups. How long do babies have hiccups? Babies can have hiccups several times a day that lasts 10 minutes or longer. Baby hiccups aren't a reason for worry if the baby acts happy and doesn't appear to be suffering from pain. It can be concerning, especially for new parents, but hiccups usually subside after a few minutes. When should you be concerned about hiccups? Hiccups are quite common in infants. They can also happen while the baby is still inside the mother's womb. However, if your baby has a lot of hiccups, especially if they're also upset or frustrated, it's time to see a doctor. It could be an indication of other medical problems. You should seek medical attention if your baby has inhalation or feeding difficulties. If their lips are blue, which may indicate low oxygen levels. If your baby's hiccups are keeping them awake. If hiccups continue to appear frequently after your child's first birthday, or in case of hiccups last longer than 2 hours. In all these situations, you must consult your doctor. Do you think we missed any point? If so, feel free to share it in the comments. We would love to get your input on this. If you found this video informative, please share it with your friends who are concerned about their baby's health and are concerned about their baby's hiccups. For more informative videos, please click the bell icon below. We'll be back with another interesting video soon.